Hello, this is Akram Jafar, and in this session I'm going to deal with the lymphatic drainage of the abdomen and pelvis. Now let's deal with the lymph nodes in the abdomen. So in the abdomen, the lymph nodes are related to the main arteries. So we have the aorta and its branches, including the anterior, lateral, and terminal branches. So the lymph nodes are divided into pre-aortic, that are related to the three visceral branches of the aorta, which arise from the anterior side of the aorta. The celiac, so we have celiac group of lymph nodes. Superior mesenteric, so we have superior mesenteric group of lymph nodes. And inferior mesenteric, we have the inferior mesenteric group of lymph nodes. And then we have a lateral group, which is also called the lumbar group. Remember that some of the lateral branches of the aorta are the lumbar arteries, the four pairs of lumbar arteries. So the lateral group is also called the lumbar group or the para-aortic group, indicating that it is located on either side, para, of the aorta. The pre-aortic nodes, as I said, the celiac lymph nodes, they drain from lymph node groups that are related to the main branches of the celiac trunk, like the left gastric, the common hepatic, and the splenic. And then, so they mainly drain the foregut. And then we have the superior mesenteric lymph nodes, which mainly drain the regions of the midgut. And then the inferior mesenteric nodes, they drain the hindgut regions. Of course, these lymph nodes that drain the intestine as pre-aortic nodes, they drain multiple other groups, intermediate groups of lymph nodes that are related to the mesentery or the serosa. So this is to show us the common pattern of lymph nodes in the intestine. Let's deal with the colon here. So we have epicolic nodes. These are additional lymph nodes lying on the external surface of the gut, which is the serosa here, or they are located, in case of the colon, they are located adjacent to the fats of the colon and the epiploic appendices, very close to the wall. And the importance of these lymph nodes is that they are the first lymph nodes to receive drainage from the colon. So this makes them clinically important in staging of colorectal cancer, one of the common types of cancers. Now, from the epicolic to the para-colic lymph nodes here, these are located in the peritoneum, that is adjacent to the margin of the gut. And then from that to the intermediate nodes that are located along the blood vessels, which are branches of the superior or inferior mesenteric artery. For example, this would be the middle colic artery. This one will be the left colic artery, or the sigmoidal arteries, superior rectal artery. They are surrounded by lymph nodes, which are called intermediate lymph nodes, and then they ultimately drain to the pre-aortic group of lymph nodes. In the intestine, apart from the lymph nodes, there are lymphoid follicles. And in certain places, like in the terminal ileum, we have aggregates of these lymphoid follicles. You can see them here. They are located in the submucosa. They are not located in the serosa. They are located in the submucosa, and as you can see that they do not have a connective tissue capsule, so they are not lymph nodes. They are lymphoid follicles, and they are considered as part of the mucosa-associated lymphoid tissue, acting as part of the immune surveillance system. In the distal part of the ileum, they aggregate together, and so they can be clearly seen in the naked eye, and they are called as Peyer's patches. Peyer's, referring to the Swiss anatomist Peyer of the 17th century. You can see them here in this diagram. The Peyer's patches are so closely related to the mucosa, just underneath the mucosa, so they can be seen from the inside of the terminal ileum. Note here that there are few plici circularis which is a characteristic of the ileum. These Peyer's patches can be visible to the naked eye as oval or rounded, thickened areas. Actually, they are located in the antimesenteric border. Remember that the ileum and the jejunum, they have a mesentery. And so these lymphoid follicles that constitute the Peyer's patches, they are located at the antimesenteric border within the mucosa and extending into the submucosa. Now, regarding the liver, is mainly drained to hepatic nodes that are located in the porta hepatis. This is the region of the porta hepatis where there are the portal vein, hepatic artery, and biliary passages. And from these hepatic nodes, the lymph will drain to the celiac lymph nodes, a member of the pre-aortic lymph nodes. In addition to that, and from the bare area of the liver, the area that is not covered by peritoneum, lymphatic vessels can perforate the diaphragm, and so they drain into phrenic nodes that are located in the thorax. In addition to that, some of the deep lymphatics from the liver, they pass along the hepatic veins that drain into the inferior vena cava. Then they pass with this vein, along this vein, through the diaphragm again, but they go to the posterior mediastinal nodes. So knowledge about this is important because sometimes direct metastasis can take place through the diaphragm to the mediastinal lymph nodes and the phrenic lymph nodes, and this is very important for the metastatic spread to the chest. A note should be mentioned here about a lymph node that has a special name. It's called lymph node of Lund, or officially it's called the cystic node. And this is a small lymph node, actually. It is located on the cystic artery, a branch of the right hepatic artery, and a region here at the close to the visceral surface of the liver called Callot's triangle or hepatocystic triangle. This triangle is very important to identify during laparoscopic cholecystectomy. The triangle is bounded medially by the common hepatic duct, laterally by the cystic duct, and superiorly it is the inferior border of the liver. And within this triangle is the cystic artery. Identification of the cystic artery is important during this operation, cholecystectomy, because it has to be ligated and cut. This lymph node, actually, it lies close to the artery. It drains the gallbladder and the biliary system. It drains them to the hepatic lymph nodes and then to the celiac lymph nodes, as we mentioned. But this lymph node is, in fact, an important landmark during surgery, because an enlarged lymph node will help identify the triangle, hepatocystic triangle of Callot, and it confirms the proximity of the cystic artery. This is to show you the reason of naming this lymph node and the triangle. So Callot is a French surgeon, and Lund is an American surgeon and educator. It seems that both of them lived during the same era. So, as I mentioned, that abdominal lymph nodes are either pre-aortic lymph nodes, which we have just discussed, and then they are the lateral aortic nodes, or they are the lumbar nodes, or the para-aortic lymph nodes. These lateral aortic lymph nodes, they drain the iliac nodes, the nodes that are located here along the common iliac arteries. And these iliac nodes receive from the pelvis, mainly through the internal iliac, or from the lower limb, mainly through the external iliac lymph nodes that accompany the internal iliac and external iliac vessels, respectively. The lateral aortic nodes, they drain lateral structures like the kidneys, the suprarenal glands, and the gonads. Here you can see that the para-aortic nodes should receive lymphatic vessels that accompany the gonadal vessels. This is the gonadal artery. So whether this one was a testicular artery, the lymph node will drain the testis, or whether it was an ovarian artery, this lymph node, which is located in the abdomen, almost at the level of L2 vertebra, is going to drain a structure, which is the ovary, that is present in the pelvis. So the lymphatic drainage in the pelvis is through lymph nodes to start with, lymph nodes that are located in between the layers of the peritoneum and the fascia. So between the layers of the broad ligament and the fascial sheaths of the rectum and the urinary bladder, there are multiple of these lymph nodes. And then from these lymph nodes and the fascial sheaths, the lymph will drain into internal iliac lymph nodes, either directly or indirectly through sacral lymph nodes that are located in the front of the sacrum along the sacral vessels. The internal iliac nodes drain the base of the bladder, the inferior half of the rectum and upper part of the anal canal, drain the cervix, body of the uterus, and the upper part of the vagina and the prostate gland as well. The other group of lymph nodes that is present in the pelvis are the external iliac lymph nodes, and these drain structures that are located superiorly in the anterior portion of the pelvis, like the uterine body, the upper part of the urinary bladder. From both these external and internal iliac lymph nodes, lymph will flow to the common iliac lymph nodes and then to the lumbar lymph nodes, as I have just mentioned here. They receive from the common iliac lymph nodes. Now let's focus on the lymphatic drainage from the rectum. Rectum is a pelvic organ, but the lymphatic drainage follow different routes. So the upper part of the rectum, there are para-rectal nodes on the surface of the rectum. These will drain along the inferior mesenteric artery to the pre-aortic nodes from the upper part of the rectum, because the rectum is a derivative of the hindgut. So it is supplied by the inferior mesenteric artery, and the lymphatics of its upper part, they drain to the inferior mesenteric lymph nodes, pre-aortic lymph nodes. However, some of them, they drain to the sacral lymph nodes and then to the internal iliac lymph nodes. The lower part of the rectum has lymphatic vessels that accompany the middle rectal artery, which is a branch of the internal iliac artery, and so the lymphatics will drain to the internal iliac lymph nodes, as well as some of them might drain to the sacral lymph nodes that ultimately drain to the internal iliac lymph nodes. So we should be careful here. The upper part of the rectum, like the sigmoid colon, drains to the inferior mesenteric lymph nodes, while the lower part of the rectum, like the upper part of the anal canal, drains into the internal iliac lymph nodes mainly. In order to understand the lymphatic drainage of the anal canal, let's have this case. A 48-year-old man consulted his doctor about a lump in his anus. He believed it had been there for about a year, but not been bothered by it, and had assumed that it was a hemorrhoid. In recent weeks, however, he had noticed rectal discharge, and on examination, the doctor found that there is a solid, non-tender perianal mass, which extended from the anus up to the pectinate line. It means that the mass is located in the lower part of the anal canal. The question is, which of the following lymph node groups should be evaluated for a possible lymphadenopathy? This will lead us to understand the lymphatic drainage of the anal canal and the meaning of the pectinate line. And this might be helpful. Here is the rectum, but this one is the anal canal. This region is the anal canal. The anal canal has two distinct regions that are embryologically different from each other. So the boundary between these two regions is this line, which is called the pectinate line. The region above the pectinate line behaves as part of the rectum, and so the lymphatic drainage is drained to the internal iliac lymph nodes, like the lower part of the rectum, while the lower part of the anal canal below the pectinate line is derived from ectoderm. It is lined by stratified squamous epithelium, and it is supplied by the inferior rectal vessels, and so it drains like the perineum and the lower part of the vagina. It drains to superficial inguinal lymph nodes. The patient here has the mass which extends from the anus up to the pectinate line, so it is involving the lower part of the anal canal. Hence, the correct answer here is that the lymph node group that will be involved are the inguinal lymph nodes. Of course, it will involve the superficial and then the deep inguinal lymph nodes. The external iliac lymph nodes could be involved, but this will be at a later stage because the inguinal lymph nodes ultimately drain to the external iliac lymph nodes. Now let's deal with the lymphatic drainage of the female internal genital organs. Remember that the lower part of the vagina, same as in the lower part of the anal canal, drains to superficial inguinal lymph nodes, not to lymph nodes in the pelvis. And then the upper part of the vagina and the cervix of the uterus drain to internal iliac lymph nodes as well as to sacral lymph nodes because some of them drain through the uterosacral ligaments back to the sacrum. The lower part of the body of the uterus drains to external iliac lymph nodes, and then the region of the cornu, where the uterine tube joins the body of the uterus, there are lymphatics that go along the round ligament of the uterus through the inguinal canal and reach the superficial inguinal lymph nodes. And then the upper part of the body and the fundus of the uterus, as well as the uterine tube, they drain to the para-aortic nodes, lumbar nodes directly. And then the ovary as a gonad, which has descended down from the abdomen. The lymphatics would go to the para-aortic nodes that are located alongside the origin of the ovarian artery at the level of L2 vertebra. Now, this is to give you a general idea of the plan of the lymphatic drainage in the abdomen. We have covered almost everything now. So lymphatic vessels that are draining the lower limb will ascend up to the inguinal lymph nodes and then will go along the external iliac lymph nodes to the common iliac lymph nodes, where they are going to be joined by lymphatic vessels that have already filtered in the pelvis and the lymph nodes that are located in the facial sheaths and the internal iliac lymph nodes. So the common iliac lymph nodes drain the lower limb and the pelvis, and they will go to the lateral aortic or para-aortic or lumbar lymph nodes that also drain retroperitoneal structures such as the suprarenal gland, the kidneys, and the gonads, although the gonads are not located in the abdomen, but their blood vessels, they arise from the abdomen or are connected to the abdomen. Ultimately, these lymphatic vessels will form a lymph trunk. Remember, we have like lymph trunks in the neck, like jugular lymph trunk. Here we have a lumbar lymph trunk. Then the lymph nodes of the pre-aortic group from the inferior and superior mesenteric lymph nodes and the celiac lymph nodes, they are actually draining derivatives of the gut, the stomach, the liver, the spleen and pancreas from the foregut, and the intestines from the midgut and the hindgut. They will together form an intestinal lymph trunk. And so the intestinal lymph trunk, the lumbar lymph trunk, they drain into the cisterna chyli, that elongated sac that is located on the abdomen, close to the right crus of the diaphragm. And from there, they will form the thoracic duct. And so the thoracic duct is going to drain everything below the diaphragm from both sides of the body. Now let's deal with this case regarding the lymphatic drainage of the testis. A 22-year-old man detected a small mass in his right testicle with a heavy feeling in the scrotum. A physical examination and ultrasound confirms the mass. Serological and imaging studies confirmed the diagnosis of a testicular tumor, as well as the staging. So this stage basically means that cancer has spread to nearby lymph nodes. And so which of the following groups of lymph nodes were enlarged in this patient? a patient who has testicular cancer and who was categorized as having spread to the nearby lymph nodes. Which of the following groups of lymph nodes were enlarged in this patient? So it is not the inguinal lymph nodes, because the inguinal lymph nodes, they drain the scrotum, they drain the external genitalia, but they do not drain the testis, which descends down from the abdomen. You can see here, this is the level of the testicular artery. It doesn't go along the external iliac or internal iliac. So the external iliac drains the lower limb. Internal iliac mainly drains the pelvis. Inferior mesenteric, they drain the derivatives of the hindgut. And so these drain to the lumbar lymph nodes. Directly, they go through the inguinal canal, then along the testicular vessels, testicular artery, and they go to the para-aortic lymph nodes. So the correct answer here, the lymph node group involved will be lumbar lymph nodes. Now let's deal with lymph nodes of the chest wall.